Knowledge about diabetes. Diabetes is a chronic disease characterized by high levels of glucose, sugar, in the blood. The body needs insulin to transport glucose from the blood into the cells where it can be used for energy. In diabetes, the body either does not produce enough insulin or cannot effectively use the insulin it produces. This leads to high levels of glucose in the blood, which can damage many organs and tissues in the body over time. Types of diabetes. There are three main types of diabetes: type 1 diabetes, type 2 diabetes, and gestational diabetes. Type 1 diabetes. Type 1 diabetes occurs when the immune system mistakenly attacks and destroys the cells in the pancreas that produce insulin. As a result, the body produces little or no insulin, and the glucose in the blood cannot be transported into the cells. Type 1 diabetes usually develops in children and young adults, although it can occur at any age. It is often diagnosed after symptoms such as increased thirst, hunger, and urination, as well as weight loss, fatigue, and blurred vision. Type 2 diabetes. Type 2 diabetes occurs when the body becomes resistant to insulin, and the pancreas is unable to produce enough insulin to compensate for this. Type 2 diabetes is often associated with obesity, physical inactivity, and poor diet. It is more common in older adults, although it can also occur in children and young adults. Type 2 diabetes may be asymptomatic, but symptoms can include increased thirst, frequent urination, fatigue, blurred vision, and slow wound healing. Gestational diabetes. Gestational diabetes occurs during pregnancy, usually in the second or third trimester. It is caused by hormonal changes that make the body more resistant to insulin. Gestational diabetes usually resolves after pregnancy, but women who develop gestational diabetes are at higher risk of developing type 2 diabetes later in life. Complications of diabetes. Diabetes can lead to a variety of complications, including cardiovascular disease, nerve damage, kidney damage, eye damage, and foot damage. High levels of glucose in the blood can damage the walls of blood vessels and increase the risk of heart attack, stroke, and peripheral artery disease. Nerve damage can lead to numbness, tingling, and pain in the hands and feet, while kidney damage can lead to kidney failure. Eye damage can cause blindness or vision loss, and foot damage can lead to foot ulcers, infections, and amputations. Treatment and prevention. The treatment of diabetes depends on the type and severity of the disease. People with type 1 diabetes require insulin injections or an insulin pump to manage their blood glucose levels, while people with type 2 diabetes may be able to manage their condition with diet and exercise, oral medications, or insulin injections. Gestational diabetes is usually managed with diet and exercise, although medication may be required in some cases. Prevention strategies for diabetes include maintaining a healthy weight, engaging in regular physical activity, and following a healthy diet that is low in sugar and saturated fats. Regular blood glucose screening is also important for early detection and treatment of diabetes. In conclusion, diabetes is a chronic disease that affects millions of people worldwide. It is caused by a lack of insulin or insulin resistance, and it can lead to a range of complications that can affect many parts of the body. Treatment and prevention strategies focus on maintaining healthy blood glucose levels through medication, diet, and exercise. Prevention of diabetes involves adopting a healthy lifestyle and reducing risk factors that can lead to the development of the disease. Here are some key prevention strategies for diabetes. Maintain a healthy weight. Obesity is a major risk factor for type 2 diabetes. Engage in regular physical activity. Regular exercise can improve insulin sensitivity and reduce the risk of developing type 2 diabetes. Aim for at least 30 minutes of moderate intensity physical activity on most days of the week. Follow a healthy diet. A healthy diet can help to prevent diabetes. Focus on eating a balanced diet that includes plenty of fruits, vegetables, whole grains, and lean proteins. Limit your intake of sugary drinks and foods that are high in saturated and trans fats. Avoid smoking. Smoking can increase the risk of developing type 2 diabetes. Manage stress. Chronic stress can increase the risk of developing type 2 diabetes. Practice stress management techniques such as meditation, yoga, or deep breathing exercises to reduce stress levels. Get regular checkups. Regular checkups with a healthcare provider can help to detect early signs of diabetes and other health conditions. It's important to have regular blood glucose screenings if you are at high risk for diabetes. In conclusion, adopting a healthy lifestyle that includes regular physical activity, a balanced diet, and stress management techniques can help to prevent diabetes.